Welcome to Unstitching ADHD Urban Ed Talks. I'm your host, Dr. Stanley Ekiyor. This episode will explore the latest insights and research strategies for managing ADHD in urban educational settings. Today, I intend to examine attention deficit hyperactivity disorder, often referred to as ADHD, covering its definition, prevalence, diagnosis, and available intervention options. To start, let's define ADHD. ADHD is described in the Diagnostic and Statistical Manual, DSM-5, by the American Psychiatric Association, APA 2013, as characterized by persistent patterns of inattention, hyperactivity, and impulsivity, or combined, that impacts an individual's academic, social, and behavioral functioning in most settings like the home, school, and community activities. The key point in this definition is that it is a consistent pattern that negatively impacts the individual's functioning. So let's break down what these three types, inattentive, hyperactive, impulsive, and combined, might look like in schools. Inattention symptoms. In this case, students are easily distracted, unable to pay close attention to details in the classroom. They are very forgetful, so most times we compare that to them lying because they actually cannot remember what just transpired. They may not seem to listen when spoken to and have difficulty organizing tasks. So you find out that they can't find where they kept things. They have all their things all over the place. So let's look at those that fall within hyperactivity symptoms. These students consistently fidget with or tap their hands or feet, or at times they squirm in their seats, right? They may leave their seats in situations when remaining seated is expected, when you want them to sit and focus. They might run around, climb in situations where it is inappropriate. Of course, we all know those are not expectations in the classrooms. They are often unable to play or engage in leisure activities quietly. They most times talk excessively. What about impulsivity? In this situation, students may blot out answers before a question has been completed. You know, those kids, you're trying to ask questions, and before you even get to the end of your questions, they've given you the answer, and most time the answer is not correct. And that can be very, very challenging in the classroom. They often have difficulty waiting for their turns. They may interrupt or intrude on others, most times butting into conversations or games. They act without thinking about the consequences, most times behaving in ways that are very risky. Now, there are students that display all these different symptoms. So that is what combined represents. They display inattention, hyperactivity, and impulsivity all together. These symptoms can vary significantly in severity from person to person, affecting their academic, professional, and social lives. So now let's pause for a minute. Now we know what it looks like, feels, and sounds like. How do you define your classroom structure as an educator? Let's reflect on our classroom rules and expectations. Do you think these expectations are welcoming to students with ADHD now that you know the symptoms? Are urban schools currently designed to include students with ADHD? If not, what are you going to do about it? Will you go the extra mile to be there for that one student? I know this is not easy, but I have experienced many positive outcomes with the right mindset and support. Let's talk about how common ADHD is. You know, ADHD is more prevalent than most might appreciate. According to the Centers for Disease Control and Prevention, CDC recent data set, ADHD affects approximately 5 to 10% of children and 2 to 5% of adults worldwide. An estimated 7 million, 11.4% US children aged between 3 to 17 years have ever been diagnosed with ADHD. The prevalence of ADHD vary based on factors such as geographic region, diagnostic criteria, and the population being studied. These variations highlight the importance of understanding the context behind these numbers. Now, let's dive into how ADHD is diagnosed. The diagnosis of ADHD is based on guidelines from the Diagnostic and Statistical Manual DSM 5 in the United States, which includes a comprehensive evaluation of symptoms and their impact on daily life. To be diagnosed with ADHD before age 12, a child must display 6 or more inattentive and hyperactive impulsive symptoms in more than one environment. When we talk about more than one environment, we're talking about home, school, and community activities. Also, this has to be inconsistent with their developmental level and negatively impact social and academic activities. For adults and adolescents, 17 and older, the ADHD diagnostic criteria indicate at least 5 inattentive or hyperactive impulsive symptoms for a clinical diagnosis. So let's move on to the assessment process. Diagnosing ADHD typically involves clinical interviews, behavioral questionnaires, and sometimes cognitive testing. It's a detailed process aimed at distinguishing ADHD from other conditions with similar symptoms. One of the challenges, however, in diagnosing ADHD is its overlap with other disorders such as autism, anxiety, or intellectual disabilities, referred to as comorbid conditions. Thus, there is a need for thorough and careful assessment by healthcare professionals to ascertain the underlying symptoms. Let's look at the treatment options available for students or individuals with ADHD. When it comes to treatment for ADHD, there are 3 broad types that can include behavior therapy, medication, and lifestyle changes. Recommendation for the use of ADHD medication and behavioral therapy are age-specific. For instance, behavior therapy is recommended as the first line of treatment for children younger than 6 years of age. The American Academy of Pediatrics, AAP, recommends behavior therapy and medication, preferably together for children 6 years and older. Now let's expand on these treatment methods. Let's look at the implication and what is involved when we talk about medication, behavioral therapy, and when we discuss about lifestyle changes. What does that really look like? Medication treatment involves stimulants like methylphenidates and amphetamines, which are commonly used to manage ADHD symptoms. Non-stimulant medications are also available for those who don't respond well to stimulants or experience adverse effects. And these decisions are made by medical professionals based on informed decisions. Let's look at behavioral interventions. Behavioral interventions such as cognitive behavioral therapy, CBT, and parent trainings can be very effective. These therapies help individuals develop coping strategies and improve their behavior and social skills in not just only in the school setting, but at home and in community activities. Finally, lifestyle changes. In addition to medication and therapy, lifestyle changes can play a significant role in managing ADHD. For instance, regular physical activity, a healthy diet, mindfulness practices like meditation can support the overall well being and symptom management for individuals with ADHD, according to research. Oftentimes, the best approach is a combination of treatments tailored to the individual's needs, working closely with healthcare providers to monitor and adjust the treatment plan from time to time, which is crucial for achieving the best outcomes. Why evidence-based treatment? Evidence-based research provides data on the efficacy and safety of various treatment options, including medication, behavioral therapy, and lifestyle interventions. By relying on well-researched treatments, individuals with ADHD and their healthcare providers can make informed decisions that are more likely to result in positive outcomes and effectively reduce symptoms for individuals with ADHD. I will be remiss if I don't highlight some of the important facts about ADHD in this discussion. ADHD is a neurodevelopmental disorder recognized by major medical organizations worldwide. ADHD affects both boys and girls. Though symptoms may manifest differently, boys often show more hyperactivity while girls may exhibit inattention. But it does affect both genders. It does not discriminate. ADHD is not about willpower. It's about difference in brain function that require specific strategies and support. Now that we know these facts, let's discuss the legal considerations safeguarding the rights of students with ADHD in the United States. One of those acts is the IDEA, or Individuals with Disabilities Education Act, that guarantees that students with disability receive special education services that meets their unique needs. It also requires that these needs are tailored and appropriate through an individualized educational program. It also requires that these needs are tailored and appropriate through an individualized education program. There's also Section 504 of the Rehabilitation Act that ensures students with disabilities have equal access to education. Under this act, students may receive accommodations through a 504 plan, such as extended test time or preferential seating. So what do we mean by IEPs and 504 plan? IEP offers specialized instruction and services, typically a more comprehensive description of current performance levels, student goals, educational placement, and other services that the student will receive. While the 504 plan provides accommodations and modifications to help students succeed in a general education setting. Now that we know this, the real question is, how do we manage or engage students with ADHD in a general ed setting or any setting? So I want to use this opportunity to explore strategies for engaging students with ADHD. But I want us to understand that interest is key. Before we even start talking about strategies, interest is key. Why so? Research has shown from time to time that most ADHD students are associated with intense concentration and visualization of their interest, which allows them to tune out everything around them, which most times is referred to hyperfocused. This strength can be channeled into classroom activities and lessons. So let's discuss 3 helpful classroom practices that can engage students with ADHD. 1. Interactive lessons. In this situation, we want to incorporate hands-on activities, experiments, and group exploration projects that will maintain the interest of students with ADHD, and most times the class as a whole. The use of technology, such as interactive whiteboards or tablets, can be very handy to engage students with ADHD. Secondly, movement breaks. Scheduling regular breaks for physical activity to help students expend energy and improve focus can improve engagement. And realistically, every student needs from time to time to have movement breaks. So it will be beneficial to the whole class, not just students with ADHD. Integrating short in-class exercises or stretching sessions in class lessons can also support engagement for students with ADHD. Finally, multi-sensory teaching can be used to engage students with ADHD. Utilizing visuals, auditory and kinesthetic learning methods to cater to different learning styles has improved engagement for not only ADHD students, but students in general. Include videos, music interest in teaching content, physical manipulatives where students can think and be creative and come up with ideas can be very, very productive. The CDC website offers many strategies for supporting students with ADHD in the classroom. I believe with all my heart that with the right support, students with ADHD can participate in class activities and achieve successful academic outcomes. If you have any doubts, just Google famous people with ADHD and read their stories. That might be your light bulb, which will help us understand to work with what we have so that our classrooms or urban schools are inclusive. When we say inclusive, we are including everybody. Thank you for joining me on Unstitching ADHD Urban Ed Talks. I hope today's discussion has provided valuable insights into ADHD and its impact on students in urban education settings. As we weave together the threads of education, remember that every stitch counts. Whether you're a school leader, a parent, an individual with ADHD, an educator, or an eager listener, your presence adds to the vibrant tapestry of learning. You can find us on all major podcast platforms like Spotify. And be sure to check out our Facebook page. For any comments, feel free to contact us directly at unstitchingadhd@gmail.com. Until next time, keep unraveling, learning, stitching hope into our urban schools fabric. Stay tuned for more episodes where we continue to explore practical strategies and interventions to support our students. Thank you for joining us.